मुझे स्टार्ट करना है.
Yes.
So, good evening all. For today's Gurukul Pathshala, I welcome you all. Today we are going to have OSCEs and especially on a very important topic, nutrition. So, for today's OSCE session, I request our AOPG President, Dr. Jhankhana Sanghavi Madam, for her welcome address.
Thank you, Nehal. Good evening, Prajapati sir, Dr. Nehal, Dr. Lata, and all attendees. I welcome you all. Today's OSCE is in nutrition. I think after the discussion of each OSCE questions, so many people, either the students or practitioners, फंडा चेंज हो जाएगा. काफी लोगों का न्यूट्रिशन का फंडा चेंज होगा. So let's discuss each question of nutrition and get new ideas from the sir. Let's go ahead. Over to Nehal, please.
Thank you so much, madam. For today's session, nutrition, actually people think it's very easy. But if you say it is very basics, and when it is basic, it is always hard. So it requires a tremendous effort to remember every minute thing in the nutrition, as it is very important. For today's session, I invite our OSCE master, actually, the teachers of teachers and OSCE master, Dr. Baldev Prajapati sir, for giving this platform to him. Thank you so much, sir.
Thank you very much, all of you. Good evening. Let me start the session with an inspirational story. Already what we were discussing, the story with that reference. I remember that in 77, when I was student, there was Ministry of Morarji Desai, and he was Prime Minister. All of us know Morarji Desai from our own Gujarat. And there was Janata Party. And Mr. Chandrasekhar was party president, quite junior to Morarji Desai. And position point of view also, Morarji Desai was holding the position of Prime Minister of India. But when the party, the story which I read in the newspaper, during that time there was only newspaper. And that I remember that in the party meeting, Morarji Desai will take care that he will enter first in the room, will take his seat, and when Mr. Chandrasekhar enters as the party president, he will get up and respect the president. Then once Mr. Chandrasekhar said that, sir, it is really quite embarrassing to me. I am junior to you. Even you are the Prime Minister at present. And when you are standing up in the respect to me, I feel that it's not proper. Then what was the answer of Mr. Morarji Desai? That here I am attending this party meeting. I am attending as a party member, not as a Prime Minister of India. And when party president enters the room, it's the duty of every member to respect the president, party president. So it's part of my duty. I am not doing anything wrong. So I think I have learned from that you were students in the past, but now you have grown up a lot. And when you are, I will say, holding the official chair as a president or secretary, otherwise also, but in that situation, you are more respectable to me. And that I should keep in mind.
Thank you, sir.
I am following this, I will say, story or principles of these people. Second, I remember just a minute, but my teacher, Madam Desai, We lost her just 1 year back. Rajubi was president of Ahmedabad branch, and I was secretary somewhere in 86 or 87. So almost around 40 years back. During that time, Rajubi and both of us, compared to, but we are quite junior. And when we are in the annual meeting of Ahmedabad branch, sitting as the president and secretary in the front and members on the opposite, I will say, sitting arrangement, Madam will just raise the finger to give the opinion. She will not speak in between. Once even I told Madam that, Madam, it is quite embarrassing because I was your UG student, then intern, then PG, then I am assistant professor, but compared to all the things, during that time, this was the answer from Madam, that I was your teacher, but at present, you are president and secretary, Raju and yourself, and to set the example that how others should respect you. That's why to set the example, I should attend this meeting like that. That was, I remember words of Madam Desai. And to be very frank, I think I thought that when those others are listening, besides even OSCE, this is also important to learn. Anyway, thank you very much. Let us go to our agenda. I'm taking little bit liberty after, I will say, retiring or reaching that age that whether you like or don't like, probably I will speak something. Good evening, friends. I'm sure that there are so many points on the nutrition. And nutrition, usually other branches don't discuss much. But maximum discussion takes place in pediatrics. And even maximum importance in the exams also is given on the nutrition, because nutrition as such is considered a super specialty for pediatrician. Some, I will say, special topics like nutrition, growth, development, immunization. So from this point of view, all of us know that it is important for us. Let me start my PPT and straight away, let us go to this presentation. Whether my PPT is seen?
Yes, sir. Yeah, yes, sir. Just full screen.
Yes.
No, it's okay.
Okay, so let us go to this. Today we'll go on nutrition. Straight away, many OSCEs have selected from the recent, I will say, exams. This type of the story they will put that a 2-year-old child presented with the changes in the skin lesions. I will give some few seconds, 30 seconds, so that you can focus at what is seen in the pictures. And then we'll follow the questions. Straight away, many times they say that what is your diagnosis from this picture? It's a spot many times. Even in the Viva also they may ask spot diagnosis from the appearance of the skin changes.
So we are having few answers.
Yes.
One is zinc deficiency and 4 other answers as kwashiorkor.
Right.
One is flaky paint dermatosis.
Right. Please, this answer is maybe right, but, question is what is the diagnosis? So best ways to put the diagnosis. It's a question. Of course, these changes can occur in several conditions. But once I will say we have to, in the OSCE, please keep in mind that what question is that precisely we have to answer. And next question, what are the essential, that means cardinal features of this disorder? These features should be present to say it is kwashiorkor. So what are these features?
Edema. Two persons have answered.
Sorry?
Edema, sir. Three answers.
Okay. It is features, not the only feature. That is multiple.
Mental changes.
If I ask, I think before that, how many cardinal features are there? Better to answer that, and then you can go for enumerating the features. How many points are there in the essential or cardinal features?
So we have two answers, 3.
Hmm.
And one, Dr. Aisha has answered apathy, edema.
Okay. Most of the books have mentioned the 3 features, but ideally there are 4 features. And what are the 4 features? Please, every word is very important. It's a bilateral. It's a pedal, pitting edema. Not just a edema, it should be pitting. So bilateral, pedal, pitting edema. Second is growth failure or growth retardation. Then apathetic. Please here don't say psychomotor retardation or mental retardation. It's a apathy. And muscle wasting. Most of the books have not included muscle wasting, but muscle wasting is always there. So these are the 4 features for Kwashiorkor, which I think many of these questions may be the very basic, but yes, even in the PG, they address these questions. Then what are the characteristics of skin lesions in this condition? There are very specific characteristics of skin lesions. Here I have given the liberty that you can enumerate multiple, but in the exam they will say main 3 features, 4 features, 2 features, like that. But I will say here, for knowledge point of view, I wish that we should know all the features. So what are the characteristics of the skin lesions in this condition?
Flaky pain dermatitis mostly have answered.
Okay.
Dr. Himaja has said crazy pavement dermatosis also.
Right. Anything else?
Phrenoderma.
Okay. Phrenoderma is not the part of this, I would say. Yes, then suppose Viva is somebody is taking the exam, they will ask, phrenoderma is seen in which conditions? Please remember, phrenoderma is the character, it's a spiky skin elevations, particularly over the extensor aspects of elbows. And there is a characteristic of vitamin A deficiency or essential fatty acid deficiencies. So that several skin lesions of multiple nutritional deficiency, but here flaky paint, yes. Crazy pavement, yes. You may get some ulcerations or even skin changes of some critical ecchymotic patches also are seen. Anybody can explain that what is the flaky paint? I think somebody should speak even on the screen where you are present over here. What do you mean by the flaky paint?
It's better you unmute yourself and then speak, because it's
Yes,
wrong answer.
please answer.
It peels off like a flakes of paint.
Yes. How it happens so? Very good. I will say answer is right. You know that there is a hyperpigmentation of the skin. Later on, as if you see in, I will say, monsoon season, particularly due to the moisture, there is this peeling of this, I will say, paint color. Similarly, I will say there is peeling of this particular skin. And then, whatever part is seen, it is usually hypopigmented or maybe the ulceration. And that is the flaky paint in this way. That is peeling of the skin, particularly hyperpigmented skin. And what do you mean by the crazy pavement? What do you mean by the crazy pavement? How it looks like? Or with what I will say the comparison is done? Crazy pavement. Anybody?
It's like mosaic pattern, patchy areas.
Exactly. Different colored, I will say, mosaic are arranged. I think I remember in our childhood, that was a very common floor pattern. The different color, this type of the mosaic will be selected and then we arrange in some specific design, and that type of the appearance, different color, different designs, and then appearance the crazy payment. Some people are comparing that when there is a lake or pond is there and there is no water and it is dried up, and with the cracks, whatever these, I will say, appearance is seen, it is like that. So here also what happens, the skin is dried up, it is scaly, and hyperpigmented, hypopigmented, different type of the patches are seen, and appearance is like that. Therefore they say crazy payment. Ulcers and other things are, I will say, self-explanatory, we understand. What deficiencies cause these skin lesions? What particular elements are considered responsible for these skin changes?
Essential fatty acid deficiency,
Okay.
vitamin A deficiency.
Please always remember that kwashiorkor is basically the protein deficiency rather than the fat deficiency. And fat deficiency is classically seen in marasmus. But here we know that kwashiorkor, the basic theory or basic problem is with the proteins. So the deficiencies probably should be related to some components of protein deficiency. And of course, the vitamin deficiencies also, you're right. Now, with that hint, are you able to consider which protein deficiency components may be responsible? Particularly with the color, with the skin, if you remember, as a whole in metabolism. You know that tyrosine is responsible for that. Tyrosine and phenylalanine, they are responsible for this, even the hair changes, color changes, skin changes. And therefore, even in the phenylketonuria, if you see tyrosinemia, in phenylketonuria, basically the tyrosine is involved. So tyrosine is the basic substance. Niacin, yes, it causes the hyperpigmentation like pellagra. Zinc deficiency, yes, it can cause even these enteropathica like or ulcerations even, and even vitamin deficiencies. So these are the multiple, I will say, nutrient components are responsible for these skin changes. What are the common sites of the skin lesions? So I think from the common sites also you'll be able to answer, even suppose in the spot or even the viva patient is there, some examiner may ask you. So what are the common sites of the skin lesions?
Answers are buttocks, thighs,
Yeah.
then hair change. Somebody has asked to Karam's phone.
Yeah.
Hair change.
Please remember one thing, that in the body, whenever there is the friction parts or the pressure parts, these are the commonly affected. Naturally, the skin is going to be involved over these parts. When there is a friction, that means creases, or even the exposed parts, but they come frequently and directly under, I would say, contact of some object and pressure. And from that point of view, remember, buttocks, yes, because pressure effect, perineum, yes, particularly as I said, from the friction point of view, even groins and thigh. So these are the very common sites for the skin lesion. And somebody will ask you that why are they common? That means areas of the body having the particularly creases or the frictions and these pressure effects, they are commonly involved. Of course, later on, any part can be involved. Somebody may ask that who was the person to coin the name kwashiorkor? General knowledge question. Anybody? And how even what is the meaning and how it derived? Now probably this is a good time that we don't see much kwashiorkor. As a student, we used to get multiple patients, multiple. Even the pediatric residents, naturally, particularly the winter season, we'll have to be very careful because several such patients will die suddenly due to hypothermia, hypoglycemia, dyserythrocytemia, very common. Anybody having the idea how the kwashiorkor name was derived by whom? And
Sir, one answer. We have one answer, sir.
Yeah.
Cicely William.
Yeah, absolutely.
Hmm.
And from which language it is derived? What is the meaning?
It's African language.
African language, but which
Hmm.
language? I think it's a good, smart answer. African, then you can find out the what.
Washa.
Actually, it's a Ghana language.
Ghana.
Ghana language. From that, William Cecil derived this Kwashiorkor terminology, and that appearance was like red baby from that. Anyway, let us move to. Similarly, I will say I have selected some of the OSCEs, but they can prepare absolutely the whole thing on marasmus also. Here it will be absolutely the spot. They give some seconds and then the questions, they flash. Try to focus over this way. I'm sure it's not that difficult. Now let us go to the questions. What does it show? That means what do you call this particular thing seen in the eye?
So we have already multiple answers,
Yeah.
multiple persons answering, but it's spot.
Yes. And diagnosis, we know. But somebody in the Viva, they may ask that describe it. What is the description of this bitter spot? How they are looking? What is the appearance? Or somebody will say that you can describe it. Any answer, Lata?
Triangular suggests now, Dr. Tukaram has answered triangular.
Okay. Shape is right.
Triangular. Side at least to tell. Foamy, irregular. Dry, white or grey, foamy patches, foamy.
Okay. I think the multiple people answer, then multiple words will come, and if you make it together, you'll get the answer. Anyway, please remember I'm multiple times, I'm giving the hints to the students. And you should prepare in this way. Anybody will be able to answer such questions. But if you want to make the score, then I think you should go with the preparation, that if somebody is asking me, how I will answer. And I'm sure that you have read, but if you prepare even mentally that what will be your response, which should be something different from other students. That's the thing, that how you can get the score. Most of the students will be able to answer, but they plumble here and there and like that. But if you use very clear, precise, very specific words, then the meaning is directly that meaning. And for that reason, suppose if you have to describe the bitter spots, they are usually, yes, somebody said triangular or irregular in shape, maybe the ovally one. Usually appearance, it is dirty white, foamy appearance, and it is actually the collection of keratin. I think if you put it, there is no even the second explanation for something else. It's the only bitter spot. So I think there are several things in the MD examination, because I always prepare the student that your response should be something different and very precise. Exact, you define that which word I will use, and that will really definitely make difference in your scoring. As many times I give the example that if somebody is asking me the definition of nephrotic syndrome, don't say just proteinuria. Very correct answer is nephrogenic range of proteinuria. And then what is the nephrogenic range? Exactly the first, I will say there are 3-4 criteria, but the very precise, reliable criteria is protein creatinine ratio, more than 2, or 40 milligram per square meter body surface area per hour, or 1 gram per square meter body surface area per day, or roughly +3 or +4. All the 4 answers are correct. But if you want to be very precise, then you should select that what will be my first response, what will be my second consideration, and what will be my last. So accordingly, I think I wish that purposefully I am conveying this message to the students that it makes difference. Anyway, this is very important that suppose if you diagnose, I have not asked for the classification, but I'm sure that all of us should know that WHO classification for vitamin A deficiency. But suppose if you diagnose that, what is the treatment? And you know, every pediatrician of this country should know.
So we have answers, few answers.
Yes.
Day 0, 128 based on age, mega doses of on day 1 to 14 days of vitamin A. At least you should mention the dose and all. No? Vitamin A start 1 and 14 days. So 3 different answers we have got.
That's why I first decided, and I told that the answer should be, I remember Ambedkar sir. He always say A, B, C, D. A means accurate, B means brief, C means clear. Our answer should be like that. Here, I think you know it, and this type of the question, that means answers will be very precise. Please remember, less than 6 months first decide the dose. It is 50,000 units. 6 to 12 months, 1 lakh. And more than 1 year, 2 lakhs. So this is according to the age, dose will be there. What will be the schedule? Total 3 doses. First day, second dose should be next day, and third dose should be 4 weeks later. But suppose somebody says our child is hospitalized, many times this patient will be having some other problems and most of the times hospitalized, then before you discharge. But ideal this schedule for the treatment, and please remember, somebody say mega dose, don't mix up it. That is for the national prophylaxis program. This is for the treatment. And again, I insist, in the OSCE, answer should be precise, then and then you will get the answer. I will say mark. Just I will say whatever you have written, not necessarily you will get this, because answer sheet is provided to the examiner. Examiner will not be also change answer according to his thought. He has to follow the answer sheet. And nowadays, you know, even that is also checked by computer. So that is that. That's why I will say OSCE is tough from this point of view. Now I'm coming to this, I will say question. What is this prophylaxis program, national prophylaxis program against this nutritional disorder? Because you know, in the question I have mentioned nutritional disorder, because in the question I will not answer vitamin A deficiency. Otherwise, on the third question, you will come to know that, oh, it's a vitamin A deficiency. So what is the prophylaxis program? Prophylaxis program I'm talking. Anybody?
No, sir. No, just a vague answer. Vitamin A prophylaxis. Prophylaxis. It's not an answer, actually. You should mention the dose, the timing.
Please remember, even you are going to get the short case of malnutrition, PM. You know, it is very common. And in that case, whatever I will say patient is having, most of the examiners are going to ask these questions. I'm sure that most of the examiners will ask. And therefore, you should be well prepared. Please remember, first criteria is the age. That is from 9 months to 59 almost, that means 5 years. First dose at 9 months with the measles vaccine is 1 lakh unit. Second dose at 15 to 18 months with the DPT booster, that is 2 lakhs. And then every time 2 lakhs at the interval of 6 months till the age of 5 years. And that comes to total 9 doses. So please remember, this is the National Prophylaxis Program for Vitamin A. Now here somebody may ask, on the contrary, I wanted to discuss something more beyond this. This program was devised long back. And there are now certain articles, if you are reading in the journals. So what modification they are suggesting to us. They say that with this current situation, probably this national program needs some changes. So what changes they are suggesting and why these changes are suggested? What is the rationality or explanation for the changes? Anybody? I think even this is given in Madam's Elizabeth's book.
Mm-hmm.
She has mentioned this point, I remember. And even these articles, probably the last 5 years, several articles have appeared. And probably in the very short time, it may go for some modification. And sometimes when some practitioners also ask me when we discuss that really this required any answer, Lata?
Overdosage, sir, one answer. Chintala's book.
Okay. But why the overdose? That means anyway, but the person is having some idea. I will, in the exam, always I consider in this way. Sometimes you may not be able to remember precisely, but you have some idea. You have read somewhere, somebody has talked. Suppose here we are discussing, in the exam somebody will be able to answer. We may not be probably knowing exactly. You know, now this program, that's why I said this program was devised, I don't remember exactly, but many years back. And during that time, vitamin A deficiency status was different in our country. Now there is much improvement. And with that improvement, we should go for the revision. Otherwise, very exactly what somebody has answered, that people are suspecting, probably even HPS Sachdev in Delhi, he's very good nutrition specialist. And another person is Dr. Shah from again Delhi. He is also very much, I will say, talking a lot, and even the research work on this nutrition, particularly vitamin A and others. And what they say that if we continue these mega doses, some children may develop even the toxicity. And if it is really developing, we don't have the idea. So they say that we should go for the revision, know exactly. And some even practitioners are asking that suppose in the general, I would say, private practice, when you are getting these children from this, I will say, affluent family or good family, that means economically they are good. And these children many times on the contrary, obesity and overweight, and hardly the question comes of even this vitamin A deficiency. In these children, should we go or not? So these questions are really there with this program. And as a pediatrician, we should be aware of it. Then what is, third, therefore, I think there should not be confusion in the different situation. Third situation. What is the dose and schedule of this nutrient for a child presenting with measles or severe acute malnutrition? There may not be the deficiency, but still, it should be given. And then what is the schedule for that? Any patient, on the contrary, I remember even when we were in I will say I was in the civil or young resident or even AP, we used to get the many patients. And it is said that even vitamin A in the measles is a dire emergency. If you don't give it, it's possible that the child may later on come with the blindness or keratomalacia. And therefore, even similarly with the severe acute malnutrition. So what is the dose? Any idea?
Only one answer we have got by Dr. Himacha. On day one of admission, dose given as per age. That's it. She has answered.
Okay. Please remember, 2 doses are there.
2 doses.
Less than 1 year, they say 1 lakh unit. Older children, 2 lakhs. And vitamin A drops probably are available in your OPD. Even in the table, Viva table, they are going to keep this bottle of the vitamin A. And they will ask the question, what is the concentration even? 1 ml contains 1 lakh unit. Please remember. And here, less than 1 year, 1 lakh units. Older children, more than 1 year, that means 2 lakhs. And consecutively 2 days. So this schedule of vitamin A for treatment is different, prophylaxis program is different, and for measles and SAM is different. So that I will say we should remember in the practice. Okay, this is the picture of real which we have seen. An infant presented with severe anemia. I think it looks even quite pale child. And there was regression of the motor milestone. Child was irritable. That also probably we are able to make out in the picture. And vacant look. This is the description and this is the picture of the patient. Having this, let me go to the question. What is the diagnosis? Even, in the exam, suppose if it is available, such patient is there, they will keep it as a spot diagnosis. You know that one I will say short presentation, short cases, then the one is the spot. And here you don't ask anything. Examiner will not inform anything. Don't even touch the patient and give the answer. So what is the diagnosis?
We have few answers, sir.
Yes.
Infantile tremor syndrome,
Yes.
megaloblastic anemia, and one answer is epidermatitis enteropathica.
Here they have asked the diagnosis. So we'll not be able to say megaloblastic anemia. Anemia, yes. But what type of anemia? Difficult to answer from this. Or suppose some feature is there, you can suspect, but you can't. And here anemia and some others put together. That's why, I have given this scenario. Please always even remember that some scenario is given purposefully. Here I think with this scenario, there is no DD. Examiner should also learn how to frame the question. If you have framed the question appropriately, there is no DD. With this, I will say picture and this scenario, answer is very specific. Child is having a severe anemia, regression of motor milestone. In which condition the child presents with the regression of motor milestone? Irritability and vacant look. And with this picture, answer is only very specific, that is infantile tremor syndrome or anemia tremor syndrome. Anemia can occur in so many conditions. Tremor can also occur. Vacant look and everything. But regression, anemia, irritability and everything, that means answer is, even that's why I say examiner also should know how to frame the question. Even if I talk in general also, it's not wrong. I'm going this, I will say, National Board Office for training of this, even the teachers, that how they should form these questions, OSCE questions. And we discussed so much that framing the question is also very important. Anyway, then what deficiencies cause anemia in this term? Now this is the, for anemia also there is very specific question. What deficiencies cause the anemia in this disorder?
B12
Yeah.
answer. So
Yes.
B12. All
Okay.
are answered as B12 and folic acid also, sir. B12 and
Right.
folic acid.
And no iron?
They are not interested in iron, sir.
Iron is there. It's always there. It's a multiple deficiencies. But even here specific B12 deficiency, I agree. But iron and folic acid. So iron, B12, folic acid. Further, what are the treatment components of this condition? Very simple question now. I think already deficiency mentioned. So to save the time, I will go, iron, B12, folic acid. Even, these trace elements also considered heavy: magnesium, zinc, calcium. Here exactly, I think I will come to this topic later on, because I want to give even some, I remember once even in the MD exam, full question was asked. Infantile tremor syndrome, to insist the students that we should know. Anyway, I think before that, I'm sure that what is the common scenario for the infantile tremor? What particular maternal factors are playing the role? Anybody? What maternal factors are playing the role, particularly from the nutrition point of view?
Maternal B12 deficiency.
B12 deficiency in mother.
Veg diet. Veg diet.
Okay, very good. That's very important. But
Sorry, sir.
as a whole, all of us know that these nutritional problems is very rampant in our country. But very specific factors probably they coin, their focus. That probably they are playing a very specific role for this condition. And we don't know the exact even the etiology at present. Various hypotheses people have put forward. But what factors they consider at present more responsible? One is particularly, please remember, yes, maternal deficiencies. So much deficiencies, and particularly when the exclusive breastfeeding is given. It is very important, prolonged exclusive. That means beyond 1 year even. Only breastfeeding. Then probably not sufficient, child is not getting all the nutrients. So mother is having the deficiency, particularly B12, and only the exclusive breastfeeding beyond 1 year. And even the other factors, particularly somehow, that's why people are thinking, even the more common in the male children. Even the more specifically in the vegetarian group, that is also right. And somehow, in short, they don't get these B12 mainly. And of course, these associated iron deficiencies and others are also there. I think there is very, very much interesting story of infantile tremor syndrome. This disease was, I will say, coined or given the name by which country? Any idea?
India?
Yes. Good answer. I would like to know the person.
Dr. Sangeeta Trivedi from Surat.
Madam. Then naturally.
Good evening, sir.
Good evening. And here even some discussion is going. Somebody will ask, can you name some other diseases where we have coined in India? Some other disorders. On the contrary, India has very less, I will say, contribution in medical science as a whole, if you see. But yes, some contribution is there. And
it's Indian childhood cirrhosis.
Indian childhood cirrhosis, yes. Even the infantile tremor syndrome, yes. Like that. Infantile tremor syndrome was first reported by Dr. Dixit in 1957. That means the disease is not, I will say, that old one. 1957, less than of my age. So it's not the old one disease. And different names, I remember that the major contribution was for recognizing the disease was by many people. Dr. Pohowala from Indore. Then Dr. Malti Jadhav, Madam Desai's, I will say, friend from Vellore. Unfortunately, we lost both of them. But Dr. Malti Jadhav's contribution for this disorder was significant. And that means in the India, different people were observing this type of the problem. And they give the different names. Somebody will say meningoencephalitis. I think Pohowala sir said it is the following some viral. Somebody said given the nutritional dystrophy. These type of the names were given by their own. And B. Sharda from Udaipur, last I think 1987, he worked maximum. And then this terminology was coined, infantile tremor or anemia tremor syndrome. That is, I will say, just the story. And somehow now there is the drop of this condition. Really, with this awareness of breastfeeding, complementary feeding, improvement, but still disease is there. Please, can you?
Zoom in, sir. Zoom in, sir. Please mute yourself. Zoom user, please. Zoom user, please mute yourself.
And this from Gujarat, from where this even this it has been reported in journals also. Anybody saying the idea? Maximum reporting from Baroda Medical College. And I remember when I used to go to Baroda for exam, MD exam, I used to tell Madam Dulari Ben and even Dr. Uma and Dr. Shaila here that I'm getting the benefits of coming Baroda to learn anemia tremor syndrome. Invariably, when the patient will be there in the exam. And second, even the sickle cell disease. Sickle cell somehow hardly we get in Ahmedabad. But Baroda, yes, because nearby the tribal area is there. So even I remember probably Dr. Shaila here, Dr. Uma Ben, they have reported. Recently, probably even from the Parul also there was reporting. Even last probably from Vijay Medical College, Dr. Gargi and Anuya, with the help of some of their students, there was reporting. So I think we should know our local situation also, what the epidemiology is going on. Examiner is not interested in only book picture. They want to know as or how much you are aware of it. What will be the typical cry of this baby? Please try to answer. Because cry is very typical of these babies.
It's tremulous cry.
Yeah, tremulous cry.
Bleating of goat, somebody has
Yeah,
answered.
bleating of goat. Very good. Very good. Exactly. Why it happens so? What is the explanation? Why it happens so? Why there is tremulous cry? Or as if the voice by the goat.
Vocal cord affected, laryngeal laxity. We have two answers. Then
Vocal
cord.
vocal cord involvement, yes, but what type of
That is
involvement?
correct. The tremor of vocal cord.
Tremor, that's very, very good. Very, I will say, easy to logically you can answer. There is a tremor of these vocal cords also. And that type is very characteristic. I'm sure that next time if you see the patient, try to see. Somebody will ask you, incomplete ITS is also there. I think exam point of view, somebody will ask that what is the incomplete or what are the phases of ITS in infantile tremor syndrome. Pre-tremor is the very people say prodromer also or incomplete. That is the pre-tremor. Tremor, I will say the very classical stage of tremor. And then even the post-tremor is also that recovery phase. And please remember, I think those who are treated must have seen, these patients are taking very long time for the recovery, months together. But one thing is very certain, that they do recover very nicely. And so that means after a few months or year even, you will see that the patient is totally recovered, even from the development point of view. So it is quite rewarding condition. I think many things are there, but we'll not just spare it. One important theory I would like to share for this infantile tremor syndrome. And they say that is the transient defect in the tyrosine metabolism in this infantile tremor. For the hair changes, and even through particularly how it happens, there is the involvement of substantia nigra. It's a part of the basal ganglia, which is responsible for the tremors. And vacant look is Parkinsonian appearance. That is also the involvement of basal ganglia. So these are the explanations, and I will say one of the theories, the metabolic theory. That there is basic problem with the tyrosine, besides all these factors. And there is the involvement of the basal ganglia, particularly the substantia nigra, and even some parts of other where these vacant look like Parkinsonian and even this tremor is seen. So, and I think little bit it is convincing looking at the story. So I thought that many points are not given in the textbooks. But I thought that if I share, it will be useful, even exam point of view, in the practice point of view also. Let us move further now. These are the pictures of my own patient long back, many years back. All the 3 children from one family presented with diarrhea, which Modasa, I think this patient was referred from Modasa. That pediatrician said that diarrhea is now controlled. But now these type of the things are there, and he sent to us, we confirmed the diagnosis, and they responded well to the therapy. You can try to focus of the same family children. Look at this, I will say, activities. Try to focus that this particularly change of the color of the feet, even knees, you can focus, and they were also in the diarrhea. Now the question is, name the condition. Fortunately, probably now, this generation is fortunate that don't get this type of the patients commonly. We used to see even this kind, and this probably I have seen almost 15 years back.
One answer is, it's not answer, it's a question. Niacin deficiency.
Sorry?
Niacin deficiency.
So it's an answer or question?
It's question, sir.
that means not sure. Okay.
Yes. One more answer, niacin deficiency, but it's answer, not question.
But I think, but somebody says condition, diagnosis, then better to give this name of this, what name is given to this deficiency? It's a pellagra.
Yeah, so someone has answered, sir. Pellagra.
Yeah, it's a pellagra. Nice. And you know why? Because one particular family, and what is the, I will say, staple diet for this family, which will lead to this deficiency? I have not put the question, but I am asking, what is the staple diet from this family, which leads to this niacin deficiency?
Maize. Everybody's answered.
Yes, maize. And you know, in the Panchmal district in Gujarat, this corn or the maize is very, I would say, staple diet. And this patient was from that area. We treated it with the help of even one dermatologist because we wanted to confirm, and responded very well to niacin. Which amino acid deficiency results in this condition? You know, basically this deficiency of niacin, but niacin is responsible for one amino acid. And then it results in this clinical picture.
So it's not, somebody has answered tyrosine, but 3 people have answered tryptophan. 4 people.
Sorry?
Tryptophan, sir. Tryptophan.
Tryptophan, yes. The correct answer is tryptophan.
Yes, sir.
Anybody can answer in which metabolic disorder tryptophan is involved? Metabolic disorder. Because you know it is related to that. That's why I'm asking. Hartnup disease, yes. And how the Hartnup name is devised? Hartnup name is devised how? From the name of the scientist? From the name of the town? How the name is derived? Anybody? It's another question. Any answer, Lata?
No, sir. I'm just waiting.
Please remember another thing in the exam. Examiner does not come with the preparation of the questions. According to the patient, according to your responses, he will try to assess that how much you know the subject. And I think examiner should also have this habit that your I would say aim is not to ask one particular case or question something. Know as a whole that how much this person knows the subject. And therefore I would say these type of questions are going to come. Hartnett name is there. Any Lata, any response or should I answer?
The one response I have there, place name.
Sorry?
Dr. Chintala. Place, name of place.
Name of the place. In which country it is located?
Dr. Chintala has answered. Sorry, Dr. Abhiram Prasad has answered family name.
Yes. This is the name of the family. I don't remember the exact town, but that was in UK. In UK, the Hartnett family, the first family was involved or detected, this disease was with that family. And from that family's name, the Hartnett disease name is derived. And what is this first metabolic disorder which was identified? First metabolic disorder. At present, for your kind information, we are knowing more than 580 or around 600 metabolic disorders now. But which one the first one which was known to us or detected?
Glycogen storage disease.
Okay. Anything else?
No, sir, no answers. Even not from my side, sir. I also don't know.
Answer is on the screen.
What is this?
Hartnett disease was the first disease.
Okay.
Metabolic disorder.
So that's why sir is teacher of teachers.
Answer is on the screen only. Anyway, let us move to the next. I'm sure that in the OSCE, we'll be able to learn many things, both the ways, exam point of view, even in the practice point of view. I'm sure that next time some patient comes, immediately we'll be able to identify. Here again, this was the patient in GCS Medical College, which was seen by my colleague. It was not in our unit. It was reported later in the journal. A 3-year-old boy presented with hair loss of the skull. You can see the first picture, and then after some time with the growth. Anyone with a history of diarrhea on and off, probably for many years, treated with various antibiotics without any benefit. And these are the pictures of pre and post treatment. Even you can see the knee lesions also and after the treatment. And even the buttocks also. These were the lesions. This was actually reported by Dr. Pinakin Trivedi and his unit. Now, I think answer should be very easy. What is the
Yes,
diagnosis?
So answers have already come. Acrodermatitis enteropathica.
Very good. It is the acrodermatitis enteropathica. Perfect. What is the treatment? If you are knowing the element responsible for that.
Zinc. So they have already answered.
Very good. Oral zinc we can give.
Oral zinc.
What are the manifestations of deficiency of this element? Other manifestations? That means zinc deficiency. How the zinc deficiency can have other manifestations known to us.
Growth failure. One person has answered. Dr.
Yes.
Parikh.
Okay. Right. Anything else? I think so many. Now, on the contrary, people say that every branch is considering zinc deficiency. Medicine, pediatric, even obstetricians, they are considering. And it can cause malnutrition. Perturbed skin is probably basic dermatitis, growth retardation. Some people are sending even for the growth hormone estimation, but maybe due to the zinc. Even hypogonadism, one of the reasons for sterility, obstetrician they consider. Even for immunity, thymic atrophy, alopecia, diarrhea, very specific terminal, I will say condition, acrodermatitis enteropathica, which we discussed. And even sometimes patient may present with only reduced taste sensation. Which conditions will cause the problem of reduced taste sensation or altered taste sensation? One is the gene. Second is the infection. Which infection? Which was having the form of the COVID. Many viral are known, but particularly the COVID is very specific. change in the taste and smell. Maybe the early manifestation, and people say even the zinc element point of view is involved. Therefore, in adults, people say, I'm learning from the physician, that they get these several patients with just this sensation problem. And then if they treat with the zinc, they do respond. So these are the, even the obstetricians are considering this, even one of the reasons for the sterility of zinc deficiency. This question will be in different. What is the dose of this element in acute diarrheal disease? Daily we are prescribing. This may be I will say, oral zinc drops on the Viva table, and then they will ask the question. These are the various ways that ultimately how they will address the questions to you. Anybody? I think there should
This is
be.
a very easy
Everybody
question.
should be able to answer. Everybody should be able to answer.
Sangeeta Madam has answered 20 mg. Dr. Rutvi has answered less than 6 months 10 mg, more than 6 months 20 mg. And what about duration?
Duration.
It should be complete. Less than 6 months.
Less than 6 months, 10 milligram per day. It's not kg. Please remember, everyone, this mistake. And in the OSCE, if you write kg, 10 is right, everything is right, but then the answer is wrong. So 10 milligram per day for 2 weeks, 14 days. Even don't write the 2 weeks. Write down the 14 days. Don't even mention the 15 days. More than 6 months, 20 milligram per day for 14 days. So here in the OSCE, sometimes they want very specific answer, and then they will put these types of questions. Look at this picture. No need to say it's oral cavity, then you can focus over the angle of mouth, tongue. In the OSCE, nobody is going to say like this. So please.
So we have one answer, angular cheilitis.
Yes. Identify the condition shown in the image. And there is the angular cheilitis and glossitis. It is due to the very specific deficiency. What is the underlying cause of this condition?
So we have already answered riboflavin deficiency.
Very good.
B2 deficiency.
It's a riboflavin. And riboflavin, that means which vitamin? Number point of view?
B2, everybody has answered, sir. B2,
Yeah.
B2.
Yes. B1. What is B1?
Thiamine, sir.
Thiamine. What conditions you know due to the thiamine deficiency?
Beriberi.
Somebody can very,
Yes.
yeah. Unmute yourself and answer. Nice. Unmute yourself.
Yes. What are the other features of this riboflavin deficiency? Other features. Anybody?
No, sir. I'm waiting for the answers. Of aphthous ulcers, corneal neovascularization, dermatitis, oral ulcers. 4 answers, sir.
Okay.
Right.
Other features are keratitis,
Photophobia,
seborrheic dermatitis, photophobia, and lacrimation. These are very characteristic of the riboflavin. So that's very important. I think somebody said vascularization in the that will happen in which condition? Not happens in riboflavin. Then in which? Anybody is able to answer?
ROP.
That is yes. I'm talking of nutrition point of view. ROP is correct answer.
Which is wrong answer.
What is the treatment of this riboflavin deficiency? riboflavin, but dose we'll have to say. 3 to 10 milligram. Again, it is per day. It's a per day. What will be the color of this riboflavin?
Yellow.
It's a question or answer? But it is correct. It is correct. It is correct answer.
Yeah,
It
yellow
is
is
correct
correct.
answer.
Red is wrong.
You know, the name is given, ribosomes from this structure point of view. Its chemical structure is like ribosomes. And flavin means yellow. Suppose, and another question even with this reference, this is the few questions I have framed. Some other examiner may even put some questions in some other format. With the angular cheilitis, if you look at even the sun rays, what will be its appearance? Or in other way, I will put the question so that you can understand. Suppose angular cheilitis, if I turn the patient, take the towards the window and turn him so that I can see the lesion through the sun rays. And if it is bluish appearance, what do you call it? Angular cheilitis looking bluish in the sun rays. What is the name of that lesion? And what is the cause for that even appearance or color?
But,
Yes?
so we have one answer, Burtonian line, but it doesn't lead toxicity. Dr. Abhiram Prasad has written.
Sorry, what toxicity?
Lead toxicity.
Lead
Burtonian line.
toxicity. Lead toxicity.
Lead.
Angular cheilitis, if it is bluish appearance, it appearance with the bluish appearance when if you see through the skin, it is called the parlesh. The name given to that is the parlesh, and it indicates a fungal infection along with the riboflavin deficiency. So I see McLaren has given the very good description of the parlesh. McLaren, I hope you know the textbook on nutrition, and I will say internationally very famous. Like Madam even Elizabeth, now that Madam has replaced that book. Otherwise, it was really commonly read by the pediatricians. Suppose if you are pouring the milk in the sun, listen to me. You are pouring the milk from one glass to another glass in the presence of sun rays. What will be its appearance? Or even sometimes general appearance of this milk even before white, besides white color. If you see, even in some vessel, milk is there, naturally it is white. But you may see that some other color is imparted in the white. And if you are pouring the milk in the sun rays, that appearance looks very clear besides white color. It is yellowish. And that yellowish color is due to what? What we are discussing. That is riboflavin. And therefore, riboflavin, milk is the rich source of the riboflavin. Please, I think these type of the questions are very important, even otherwise also. Now, they may ask in this way. That answer the following questions from the midday meal program. And principles, please remember, here answer has also come. It is a supplement, not a substitute. The midday meal is now program is going on most of the states, including Gujarat. Not a substitute to home diet. That should make it clear. It should supply 1/3 of total energy and half of the protein requirement of the child. Of course, low cost, Anyone can be cooked easily in the school, use locally available food, and there should be the frequent changes in the menu. These are the principles. Similarly, this question I have taken, I will say, from the OSCE exam only. And then I thought that I should frame this question. Even the model menu they will sometimes have, that means cereal and millets, 75 gram, pulses, oil and fat, leafy vegetables and non-leafy vegetables also. So I think we should know at least these principles, exam point of view. May not be probably routine, will be able to remember. Anyway, again coming to this question. A 5-year-old boy was brought with a history of abdominal pain, refractory anemia, and sensory neuropathy. His father is working in chemical factory, Vatwa, and family is staying in the campus of the factory. This is the scenario, case scenario. Question is, what is the probable diagnosis?
We have multiple answers, sir. Lead poisoning, lead toxicity.
Very good, very good. You must be knowing that Dr. Ramesh Bajania in our state, he's from Dragadra. He's discussing a lot because he's a member of the environment and lead poisoning. And many more, I will say, information have been derived. It's not uncommon, probably, what we consider. We are not aware of it. Lead poisoning. What urine investigation suggests the possibility of this condition? Now the people consider that it is not very specific, but yes, we used to go for that because it's easily available. Urine investigation, the presence of something, some molecule, which may indicate that this is likely due to the lead poisoning.
So we have one answer, elevated urine ALA and CTG.
Very good. Particularly urine protoporphyrin. Not exactly delta amylolevuric acid is increased. It is also involved, but the substance which appears in the urine is protoporphyrin. And sometimes many people will misdiagnose as a porphyria. But in lead poisoning, it happens so. And clinical picture is almost the same. Porphyria also present with abdominal pain, anemia. On the contrary, it will be having the more of the photosensitivity, which will not be the lead poisoning. And what investigations would guide for indication of the treatment? Because there is very specific indication. Anybody? I think it is very easy to guess from which we can decide. Any answer, Lata?
No,
Serum
sir,
lead levels.
refractory
Yeah,
anemia.
serum blood lead levels.
Lead
Yes,
levels, yeah.
we go for the blood levels of
Yes.
lead. Treatment is indicated if the level is more than 45 microgram %. And what are the then treatment options? That means what are the antidotes? Please remember, very simple is universal valve, and very specific for this lead, they say calcium versinate. And for their kind information, all of you must be knowing, in our country, they have identified some center, AIIMS Delhi, probably Vellore, CMC Vellore, and 3-4 other centers for the poisoning. They put this information of, I will say, phone number, contact number, then mail, everything. And at any time, if you have the dire emergency for some case where you are suspecting some poisoning, you can contact them. They'll be able to guide you even whether a suspicious is right or what type of the poisoning possible, what test you can do, what immediately you should start. So I think we should utilize some of the, I would say, ICU people, they are utilizing and get learning from that it's a really good help. Immediately are able to do something and save the patient. So that's very, very
Yes,
important.
we also used to take help from AIIMS poisoning centers. I
Yeah.
still have the number when I was doing DOT.
Yes. I think that's good information that all of us should know. And probably the emergency, we should try to utilize it and we can save some patient. Anyway, sometimes they ask a very specific question like this. These are the different examples that answer the following questions pertaining to vitamin E. Similarly, they ask pertaining to vitamin K in the newborn. Similarly, they ask even the antenatal steroids. They will put some title. And on that title, they will ask the question. So whole topic will be covered. So vitamin E is about nutrition, then they may ask vitamin E. What are the clinical manifestations of vitamin E deficiency in preterm babies? In preterm babies.
Hemolytic anemia, so one answer has come.
Right.
Then edema.
Yes. Very good. Absolutely right. Even hemolytic anemia, even it causes the thrombocytosis also. And edema. That is very careful. And vitamin E should be supplemented to these babies. Daily requirement in preterm babies, we should remember. What serum ratio? This is a very specific vitamin E deficiency should be diagnosed from ratio of alpha tocopherol. Alpha tocopherol is a vitamin E. Into lipid is diagnosed as vitamin E deficiency. What serum ratio? What is that ratio? Alpha tocopherol upon lipid. Anybody?
No, sir, no answer to you.
Yeah, it's difficult unless we remember it. 0.8 milligram per gram. And many I will say neonatology they follow. That's why I put here. What is the chemical property of vitamin E considered as useful effect? Its chemical property, basically it's the property of this vitamin E, and which is considered as a useful, good effect in short on the body.
So we have one answer, antioxidant.
Absolutely, very good. Very
Antioxidant.
Good. It's a very good antioxidant. And one of the, I will say, indication of using this substance in several conditions is the antioxidant. What is the concentration of alpha tocopherol in international units in 1 ml of Evian, which is available preparation? Commonly available, I think we are using the Evian drops. Therefore, everybody should know what is the concentration. Even, they will not ask any uncommon drug or uncommon for the concentration. They want to know that this concentration you should know, because daily frequently we are using. From this point of view, not just to check the memory of the person, but to check particularly that this is, and if you don't know, and just if you write down, probably it may create the problem. That's why we should know. Anybody? What is the concentration per ml vitamin E in Evian?
The 400 international unit, 2 persons have answered.
How much?
400 IU.
I think they remember vitamin D.
Yeah, they're confusing with vitamin D mostly. Huh?
Because it is 400 units per ml or even 800 units per ml is available preparation. Here it is 50 international units per ml. 50.
Yes.
And therefore, we should know that dose is 5 to 25. So beyond 0.5 ml, we should not prescribe in the preterm babies. It is, and this is when it has been happened that higher doses may create the problem of vitamin E deficiency also. Vitamin E deficiency may be the consequence of which metabolic disorder? Vitamin E deficiency is the consequence, that means end result of some metabolic disorder. Which one? That means patient presents to you with the manifestations of particularly CNS manifestations of vitamin E deficiency. That means what are the CNS manifestations of vitamin E deficiency? Which first I think that we should know. What are the what are the CNS manifestations of vitamin E deficiency?
We have the answer E beta lipoproteinemia.
Very good. Who has answered? I think, Lata, you should
Three
keep some
students.
chocolates.
Yes, sir, definitely. So this was my OSCE question, sir. The same question with acanthocytes and all. Like A beta, Dr. Sinkiran Reddy has answered.
Yeah. You know that is the A beta lipoproteinemia will cause the vitamin E deficiency. In patient presence, initial manifestations will be chronic diarrhea. That is a particularly oily diarrhea and failure to thrive. And what you will see in the peripheral smear examination, very characteristic of A beta lipoproteinemia.
I've already said no. Somebody acanthocytes. Yeah, correct.
Acanthocytes, irregular cell margin. So acanthocytes, failure to thrive, and oily diarrhea. That comes as infancy. Later on, as a deficiency, because due to this early diarrhea, vitamin E deficiency developed, and the patient presents with a CNS manifestation in the form of the hypotonia, ataxia in the older child, and that is the spinocerebellar involvement. So that is A beta lipoproteinemia. I think if you remember, you will get even some patient, and if you go for cholesterol level, it is always low. Anyway, I think we may end over here. Let us go this question as the last one. What is the ideal age for introducing following food items? They say that this question even it is discussed many times in our PM cases also. Let us see. Cow's milk should be introduced at what age? Ideal age. Somebody starts, I will say, neonatal period also. It's a different story. But
so we have few answers.
Hmm.
Dr. Gayatri Mehta has answered 1 year. Rest others have answered 2 years. Dr.
Okay.
Rutvi has answered 1 year. So 1 year and 2 years. You have two different answers.
Okay. And therefore, a correct answer is 1 year.
1 year.
Second, peanut and the seafood. Peanut and the seafood.
After 6 months, after 2 years.
Okay.
1 year, 6 to 8 months.
You know,
2
peanut
years.
and seafood, they say late. Older children, toddlers, 3 years. Egg. Because sometimes this question parents will ask you. Therefore, this is the importance from this point of view. That parents will
8
ask
months. Sorry, sir.
What age?
8 months. Sir, somebody, if you have answered 8 months, you have answered 6 months.
Okay. 18 months. You know, all these having some explanation. I don't remember exactly, but probably gut maturity point of view, allergy, manifestation of allergy can prevent it. Some of the foods can be digested appropriately. And from these various regions, they have decided. So eggs, 18 months. Meat, again, they will ask, because you know, probably the Gujarat, this may not be the common, but seafood, egg, meat, in some other states, it is common. Therefore, parents are going to ask you that at what age, sir, we should start this meat.
No answers.
Okay, 1 year. So I think, please remember this common food stuff which are used in our diet and at what age should be introduced in the children. Anyway, let us, I think this should be the last one. Lata.
Yes. So what do you feel? I'm always ready.
Write the nutritional requirement of the various nutrients. Vitamin A. You know, this is the only thing we'll have to remember. 500 microgram. I don't remember, but in the international units also it should be there. Vitamin D, I think very common and everybody should know. It is the 400 units. And therefore, I think somebody will ask that you have to prescribe only 1 drop in the newborn. Which one you will prescribe? That is the, I will say, they may frame the question in some other way in the Bible. That only one drop is then that is vitamin D. Even the, iron also in the preterm baby also later on. And in the full term, even the 4 months. So even only one, and that is indicated in the newborn, even that is vitamin D. Similarly, somebody asked that which first vaccine, I will say, vaccine-like vitamin is given to the baby. Even somebody will say that how many pricks you will do in the newborn at the time of birth. Various questions they will ask.
Vitamin K, your answer.
How many pricks it requires
That's
at
a
the
good
time
question.
of birth? That means which are routinely done, routinely required. What is the first natural vaccine is given to the baby? First, please remember everything. First, natural vaccine.
Colostrum.
Colostrum, very good. That means
Multiple.
to insist that this is what is the importance of. B12 is 0.5 to 1 microgram. It is said that the B12 is not synthesized in the body. It is always shedding of the mucosa will cause the deficiency, and it is to be replaced. Vitamin E, already we discussed in the newborn, but here also 5 to 15, 5 to 25. Thiamine, 0.5 to 1.5. What the thiamine can cause the problem? Thiamine deficiency?
Berry.
Very, yes. Anything else? In which metabolic disorder thiamine is given as a treatment? Which metabolic disorder thiamine can be given? Or it is considered that if you give it, sorry?
Somebody's answered Goucher.
No.
No, Goucher is not there. No. Homocystinuria. Next answer.
Then what is given in homocystinuria? That is the next question.
Trapped to another question.
Many times in the lighter mood, usually I will say these are the questions. That means you don't know when thiamine should be used,
Yeah.
and then you don't know which one should be used in homocystinuria.
Yeah.
Anyway, I think at some time I will prepare this one of the metabolic disorders when we will keep. I think I have plenty of this, and which vitamins can be used even that we should know in some of the metabolic disorders. Riboflavin already we have discussed 0.5 to 1.5. Niacin 5 to 15 milligram. Vitamin C, what dose? 40 to 50 milligram. Anyway, already 10:30 because.
Excuse me, sir.
Yes.
Excuse me, sir. Sir, there's a question for you from TP. Sir, which book you have beside Nelson in your background labeled Clinical Pediatrics?
Sorry, what is the question?
Which book you have beside Nelson in your background labeled Clinical Pediatrics? Somebody's reading your background, sir.
Sure, you are asking. I think, honestly speaking, many books are there with me. Clinical books, I think somebody asked.
Yeah, Clinical Pediatrics. Clinical Pediatrics. Which book?
I think Clinical Pediatrics here, I'm not sure. Because one is Nilsson, second is Piyush Gupta, then even this OP guy. Clinical books, I think in some other compartment it is there, and
I think they are searching for Piyush Gupta.
Actually, which clinical books I am following? As a student, I used to do number one is the Hutchison. Then Merbansi, I will say, wrote the book on clinical pediatrics. Later on, Dr. Piyush Gupta's book is there. One of my friends, even Dr. Niranjan Sendulkar from Baroda, and I contributed some chapters in his book. Later on, IAP requested me to write down the IAP clinical examination, and that I did probably in 2000, before the COVID, so 2019 or 20. And so many, I will say, really the interesting things are there. Whenever we get the opportunity, we'll share with all the friends. Anyway, we end over here. To be very frank, the reason is even tomorrow morning I have to travel early for one of the conferences, and that's why probably little bit I have taken the liberty. Thank you very much.
Thank you, sir.
And
Thank you.
I hope that this type of the interactions, discussions will be useful in the practice, even
Yes.
certainly the exam. I'm taking more, I will say, from the student point of view, that if they get these type of the questions, or even the OSCEs, or even the discussion, or in the spot diagnosis, so one particular material can be used in the various ways by the examiners. They can ask with the spot question, sometimes even the viva, sometimes even the table viva, they can ask some drugs or something, or even the OSCE, we can frame the questions. But if you have the knowledge, probably with the different ways of the framing the questions, but they can assess you. So with that idea, usually I discuss so that it can be useful to all of us. Thank you very much again to all of you. Dr. Jhankhana Ben, Dr. Nehal Ben, Dr. Lata, and all the, I will say, the whole team taking the interest or managing this show, and all of us are learning. Thank you very much, and good night. Good night to all of you.
Sir.
Thank you so much, sir.
Such a wonderful.
Thank you. Thank you,
I
Lata.
think sometime back also I asked all of you, because some of the even senior practitioners are there, friends are there, teachers are there. You can suggest me even some modifications if you require something, because always I am learning that which can be the good modality. Sometimes always I say that we'll feel happy that, oh, I did the good job. But we should ask them that whether in what way they enjoyed, or really their requirement is something else. They need something even in a different way. So I think even you can send me some suggestions, students, teachers, everybody, and accordingly when I will modify. I am also learning that how best we can do, right? So please send the suggestions. Thank you very much.
Thank you.
And
Thank
good
you.
night. Good night.
Good
Thank you.
night.
Good night, sir.
Good
Thank
night.
you, Lata.
Good night. Good
Thank
night.
you.
Okay, ma'am.
Good
Good
night.
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 Night. Bye.